it over highlights that fight or flight feeling. And it really disrupts your rational brain. It overcomes it with heightened emotions. In fact, the other name that is used for BPD is actually emotionally unstable personality disorder, which I don't like that one because I don't want to be called emotionally unstable, even if that's what's happening. I don't want to be called that. But that's essentially what's happening with the brain is that there's a hijacking of your actual conscious mind, and it's being replaced with um, massive paranoia that everyone's going to leave you or is trying to get rid of you or something is being triggered in the mind that makes it react. And I definitely didn't have the language as a kid to say like, oh, I'm anxious or this makes me nervous or I'm afraid or any of that stuff. It was just kind of something that I dealt with. And I remember at like, I'll say late elementary school or early middle school, asked my mom if I could see the doctor more often. Um, I think that I was the early stages of me understanding what therapy might have been. But I was like, something's wrong. I don't know what it is. I have to see a doctor. My mom would want me to explain to her what was wrong, and I didn't know how to explain it. It was just, I know something's not right. And so we'd go to the doctor more often, but it wasn't until years later that a doctor was like, oh, that's generalized anxiety disorder. It was mainly just, oh, the stomach hurts because you ate the wrong foods, or you get these headaches because you're uh, looking at the sun too long, or something stupid. And like, juvenile, just doctors not really believing what I was saying, or maybe I wasn't articulating what I was saying enough for them to understand it. But either way, there was a disconnect between what I was feeling and what the adults in my life were observing. Well, I've been now in my adult life, been in therapy for many years. I've talked to many different types of therapists, talked to psychiatrists. I have a very different diagnosis now than just generalized anxiety disorder, but I think it's something that I can say it was developed, but so much of it sounds like it could have just been the way that my brain is wired, and dealing with that wiring created more tension in my everyday life than was needed. Like, for example, like if I could have named or if other adults could have recognized that I had general anxiety earlier, then the way that they behave with me and the type of ways I learn or interact with people might have been different in a way that could take away from the stress of having anxiety or lessen my anxiety or any of those things would have been helpful um, to operate in. So I don't necessarily know if it's something that like I developed, which with me and my current therapist we've explored again, and it's definitely partially something I've developed. But another part of it we're thinking is just that is how my brain is wired, an extension of neurodiversity. It's just not the same as every person. And even then, when we talk about neurodiversity, every person is usually like this white cisgender male person who's out here like defining what every label is based off of their existence. So I don't even know if it's we can call it diversity in a way that's like different from everybody is neurodiverse. Everyone has different needs and wants, desires, etc., so on that function the way we behave and react to things. A little bit complicated. Part of me would like to say no, it's a condition, because along with generalized anxiety disorder, I also have major depressive disorder and borderline personality disorder. So those are three very um, complex, heavy, and by definition, di- disabling or debilitating. There we go. Um, Conditions, but also like a part of it is just that's the way that my brain works. Is that really a condition just because it doesn't fit into what a job or what a school system or what a society would want? I don't know if that we can call it that, but by definition, it's a condition, and I can roll with that for now. If it helps me understand treatment better, if it helps me gain access to resources for those treatments better, then I don't mind calling it a condition. I think the awareness of the diagnosis, being able to name the problem, gives me a sense of, I want to say hope, but I don't think that's the right word. I think it just gives me a sense of direction, um, as opposed to, Velma from Scooby Doo when her glasses get knocked off and she's searching on the floor, like, where are my glasses? This is just someone handing me, like, here's a pair of glasses. Now let's see if these glasses work for you. And that's a little bit more helpful. It's still a lonely journey, but it's not quite as alone because at least you can form community around certain labels like a diagnosis, and you can also form treatment styles around a diagnosis. Whereas if you're just going off of these individual symptoms that you were feeling or these individual moments that you have to reevaluate, it's harder to kind of create a personalized map all the time. Whereas if you have a diagnosis, you can kind of uh, you can start somewhere. You have an idea of what the right tools will be. I didn't like medication. Uh, Currently, I'm not on medication because um, I didn't respond well to the process. There's an onboarding and offboarding process to medication, and they say basically give yourself 3 months to adjust to it, and then when it's time to come off, they basically like, we'll give yourself 3 months to come off of the medication, and then you got to try the process over again. I think the first one I tried was Zoloft, and that I had the typical Zoloft negative effects of like, sure, you feel quote unquote better, but you're also a zombie because you have no emotions at all, and you're always tired. And for me, weight gain was a huge portion of it. In fact, that's been the common side effect for all of my medication is weight gain, which in and of itself is not necessarily the worst thing, but the way that our society operates, it creates so much more of a pressure on yourself to not hold that weight, or like there's a generalized unhealthiness to weight, like a stigma to it. So that didn't make me feel any better. Not being able to fit your clothes doesn't make you feel any better. So Zoloft was like the first one that I tried, and the first one where I said, I'm not doing this one. I think I tried Wellbutrin or Celexa next. I'm not sure which one I tried next. And both of those kind of had similar effects on the weight gaining front, similar effects on the tiredness. For Wellbutrin, it was the first time I like was able to be on this medication and still feel like I had a personality, like I had my own thoughts and feelings about things. I wasn't zombified. And then Celexa was that one probably would have been my favorite, even though I was a little bit more zombified, but I did feel lighter. I didn't feel like I was being weighed down by so many thoughts. Um, but the biggest problem with that one is I was always so tired. I would fall asleep at a drop of a dime, anywhere, anytime, no matter how important something was or how interested I was in it. I was so tired. And I think the last one I tried before I left my medication was, I want to say Lexapro. I don't remember why I didn't like that one, but I'm going to assume it's the same as the rest. I wouldn't say don't even try. I'm pretty big on just trying things for the hell of it. But that one was important to try. When I first started medication, I was suicidal, so that one definitely that was the Zoloft. Because of that zombification, it numbed me to suicidal ideation and thoughts. So essentially, it did save my life, even though it didn't create a better life for me. I was already having suicidal thoughts, and so the Zoloft's zombification process stopped me from having those thoughts. So I won't say it necessarily made me have a better life. It just made me keep living, which is, I guess, the basic goal of any medicine is to keep its host alive, and so it did that. Um, I'll say a mix of both. I won't say it was necessarily a better route in general than having medication. I think I found better ways to cope with with the world that I was living in. I found better tactics and tools with the help of my medical team um, that would allow me to feel slightly alleviated of my symptoms. I just had to work so much harder to keep that up. And that process is very exhausting. And that's why medication is often something in the back of my mind of if I can go back on medication, I could fight a little bit harder. But the other part of me is I wasn't me on my medication. So how much am I willing to sacrifice? Should I just, fight every day of my life, or should I have some days where I fight, some days where I don't fight? I wasn't sure what was best. In the meantime, I'm just trying something new. I've been on medication most of my adult life, and I'm 31 at this point, almost 32, and I would like to see what life can be without medication. I'm also in a better position in life. When you're a kid, you don't really have a lot of autonomy. Most choices aren't yours. Like I said, my mother was in charge of most of my medical choices, so that was something that I didn't really have control over. And then getting older, college, post college, there's a lot of ups and downs of young adulthood that create situations of anxiousness or depressive lows and things like that that could really affect the way that this treatment could work. Whereas now I'm in a lot more stable of a place. I'm a whole adult now. I'm in charge of my own life, my own treatments, my own health. So I have more power over the process. I've never not done my medication and not had therapy in some form. Therapy is very expensive, so there are definitely times financially where I could not afford to attend therapy. But there was never a time where I went a full year without trying to see a therapist or psychiatrist, because I don't think that medication alone will ever just be a solution. If anything, that feels like a band-aid, which is fine. It stops the bleeding for a moment and it prevents from infection. But if there's something deeper than just a small surface wound, a band-aid's not going to help. And this is way deeper than a small surface wound. So medication plus therapy was always my method, and now I'm doing therapy plus any other tools or alternatives that I can use. um, per anybody on this planet and any psychiatrist or medical advisor will tell you, there are certain things that you will do that will just help you have a better life. Balanced meals, enough sleep, moving your body, some sort of exercise, sunlight, things like that are always something that a medical person and a general wellness person will tell you, like, that's probably a good practice to have. And so that's something that I've definitely incorporated into my life without medication. Whereas when I had medication, I didn't actually have the motivation to do some of those things because of that zombification process. And then without medication slash a better situation in life, I was too depressed or anxious to do those things as well. So it's just at this point, there's a combination of things that allow me to hold therapy, process medication if I wanted to go back to that, and then these life balance things that become this mixture, like gumbo pot of things that I can use to help better my life. It's a mix, asking friends what they do to feel better, asking medical professionals what I could do to help out with the process. Googling, Google will tell you that in a hot minute, that all you got to do is get some sunlight, sleep, eat some greens, and call it a day. Um, but that's, of course, never going to be the end all be all for someone that is dealing with deeply traumatic or interpersonal, or like those issues in our life that aren't just sluggish. It's so much deeper than that. Then that those tools aren't going to be the end all be all, but they are definitely part of the process of regulating our stress and the way that we interact with each other. Like a healthier process or a more balanced process is a better process. Well, I'm incredibly anxious. Anytime I talk about mental health or my own personal journey with mental health, I get very anxious. A part of me is afraid that I'll talk myself into a more depressive state. Another part of me feels like I'll mess up and accidentally influence others to do the wrong thing or do something that I did that may not work for them. I'm always worried about that. But besides that, I feel pretty good. Borderline personality disorder is the diagnosis I struggle with most, and that one involves a whole different process than just the depressive or anxious feelings. There's different therapies, particularly for borderline personality disorder, like schema focused therapy, which is basically focusing on childhood needs and bringing that into the present of our minds, or dialectical behavioral therapy, which is just cognitive therapy specifically designed for people with BPD. So that process is always going to be a little tougher. I'm always going to feel that one a little bit more. It's a very interesting way a brain works. It over highlights stress. It over highlights that fight or flight feeling. And it really disrupts your rational brain. It overcomes it with heightened emotions. In fact, the other name that is used for BPD is actually emotionally unstable personality disorder, which I don't like that one because I don't want to be called emotionally unstable, even if that's what's happening. I don't want to be called that. But that's essentially what's happening with the brain, is that there's a hijacking of your actual conscious mind, and it's being replaced with um, massive paranoia that everyone's going to leave you or is trying to get rid of you, or something is being triggered in the mind that makes it react in this way. So that's, I'm always going to feel that. Even on my best days, I feel like I'm always going to have that to worry about. But with the process that I've come up with now, with my medical team, with my therapist, and without medication, I am reaching a point where I'm better able to handle that. Um, I don't know if I'm healing from it or if those symptoms are going away, but I feel like I'm getting used to it in a way that I can foresee in the future, and that predictability helps me handle it better. I I kind of worry against people self-diagnosing, but there's a power in self-diagnosing that isn't given to marginalized people, people that one may not already have the financial ability to get medical care. Insurance or out of pocket, any of that stuff is a complex and difficult process in the US.